I hope you can hear me because we are streaming live on both the platform, Instagram also and Facebook, YouTube also. So I welcome good afternoon, Dr. Kocher, Dr. Sandesh, Dr. Alexander, Dr. Anja Smith, and I hope people on Instagram also have joined in, so we can start a session.
He cannot hear that.
Can you hear me, everybody? Yeah, can you hear me, Dr. Sandesh, Dr. Alexander? Yeah, thank you. So let us start our today's session now. Today there were a lot of things which basically people wanted to know something about case taking, that how a case is taken and all. But let me tell you that there is not a it is not a prescribed protocol in case taking. Just check on Instagram. Get exactly what to. Yeah, यहाँ पर जो यहाँ पर. I hope there is some problem in Instagram. We'll just check out once.
No, they don't want to bother about that.
Good afternoon, Dr. Krishna, and yeah, we have few friends on Instagram also. I welcome them all. So I think we'll start a session because there are two streams on Instagram also and YouTube. If I start saying just good afternoon, good morning, half the time will be passed. So case taking, yeah. So importance in case taking, there are not. What I have experienced in my practice, I'll tell you. There are not set. It is not set protocols that when a case comes to you, start from chief complaint, then ask the patient history, then mind, then life space, and everything. It is very important to understand what the patient has come for. For example, if the patient has come for chief complaints, and if those chief complaints are very defining features, then those defining features becomes a very important symptom in chief complaints. For example, if I just today cured a case of migraine, the patient had migraine since 25 years, 25 years, but there was no change, and I have the snap on the WhatsApp also. I'll just share the WhatsApp. Give me the just. So what happened that in 25 years he had taken a lot of treatment, but there was no change, and when we started the medicine within 1 month, he has not taken a single painkiller. So it is not always that a prescribed course or prescribed case taking is important and then you get the result. I always say the most important defining feature of the patient is what you have to understand in that case. For example, that case of migraine, or for example, I'll tell you a case of migraine. The patient complains basically of severe headache. Now, in a case of migraine, the patient will complain of severe pain in the head, severe pain in the eyes, and the pain is unbearable. The patient cannot bear the light, the patient cannot bear the noise, the patient cannot bear excessive sound, excessive light and all. So if you start prescribing on those symptoms, common symptoms of migraine, you will never be able to get the remedy right, because those basically are the normal symptoms of migraine. Instead, you ask the patient, when is the migraine more or when is the migraine less. For example, lot of patients will come and tell you that whenever, for example, a patient comes and says, whenever I'm breathing deeply, my migraine is increased. So that becomes a very defining feature of that patient. On whenever I'm chewing, that becomes a very defining feature of the patient's migraine. For example, whenever there is a chewing motion and the patient says, whenever I'm chewing, I get headache, then the remedies are phosphorus, sulfur, thuja, kalika, etc. But if you see aggravation from noise, aggravation from sound, intense headache, is so much headache that the patient cannot bear it, he has to hold the head, and there is vomiting, there's redness of face, most of the time you will be accompanied with few remedies like belladonna, bryonia, gelsemium, amyl nitrosum, nitramure. And what will happen till the time you take the medicines, the patient is better. You stop it and the patient is back to square one. So in case taking, it is very important to identify first what the patient has come for, and if there is a defining feature in that patient, in the disease, that becomes a very defining feature of the patient's constitution. For example, if the patient comes and tells you in headache, that defining feature, for example, it becomes kali carb, then you know that in the case taking in relation to patient as a person's or mind, the kali carb symptom will match with the patient, because what is true to the part is true to the whole. So in generalized case taking also, kali carb will come as a very, very important remedy in case of migraine. For example, the patient comes and tells you that I have so much headache while chewing, or exposure to light, or exposure to air, or draft of wind, or a lot of music sound, but I cannot complain to anybody because I am elder at house, so I have to maintain that. So the patient is a precautious patient since childhood. So kali carb precocity, kali carb headache, and kali carb other symptom will match, and we get the whole constitution in case taking. So whenever you start taking a case, don't just open your case taking form and start, tell me your mental symptom. How do you have a bath? How do you react to heat and cold? First of all, that symptom of the patient, the chief complaint, if you can define the chief complaint in patient as a person, then it becomes a very, very important symptom of that patient constitution. I hope you're understanding that. There were a lot of questions on my WhatsApp and my Facebook and my YouTube, that importance of case taking. I don't want to tell you the details about everything, that how to see and how, but basic case taking is important. Whatever I can show you offline. Now, basically, I'm starting lecture on offline also, so I can enact and show you. But online, the defining feature of the patient. For example, if the patient comes to you with symptoms of maybe nose blocked, no, obstruction of nose. Now obstruction of nose becomes basically the first symptom or the patient has come to you. Now if you take only obstruction and then you don't define how is the obstruction, means whether the obstruction of nose is in the morning, evening, night, or because of the obstruction the patient has to get up, or because of obstruction is basically in the cold air, obstruction is basically in the warmth of the bed, or obstruction is when the patient is entering from warm to cold or cold to warm, then it becomes a defining feature of that personality. Example, I'll tell you. I had a very beautiful case where the patient came and told me there was obstruction of nose, especially when he wakes up. So whenever he wakes up from the sleep, the nose becomes obstructed. And then he had a lot of symptoms that he cannot breathe properly, and there's a lot of irritation, etc. Now these symptoms you have to individualize whether these symptoms basically are the defining feature of the patient or the normal symptoms of the remedy. This is very important, my dear friends. Okay, now on waking up, the patient appeared to be a very classical case of phytoleca. Then I just added one symptom more and asked the patient, because of obstruction, at what time do you wake up? At what time do you wake up? And immediately told that at about 3:15 a.m. in the morning, I wake up. And now, if you understand materia medica, it is not always kali carb or kali nitricum aggravation 2 to 4 a.m. If you see phytoleca, it has obstruction of nose when he wakes up, especially at 3 a.m. in the morning. This is the importance of understanding the defining feature of the chief complaint. I hope you are getting me, everybody. Amit, Jyoti, Sunita. Yeah. This is very so. First of all, if you can define a patient's constitution a chief complaint, it becomes a very, very important prescribing symptom. For example, if the patient comes and tells you, that there is a lot of pain in the nose, Now, if the patient comes and tells you there is a lot of pain in the nose, then you have to define which type of pain. It is one-sided, either it is left side, or it is right side, or in the day, or in the night, when lying down, before menses, after menses. If don't just try to just ask the symptom and jump on the mind symptom. Don't do that. First of all, define that. Because literally last month I know beautiful case of migraine, 25 years, 25 years of migraine, taken so many painkillers, nothing worked. The first medicine I gave, and the patient came today, no painkillers taken since we started homeopathy medicines. Once or twice he had pain, but the pain was bearable. The defining feature. And now when we asked the case taking, when my assistant took the case, she told, okay, sir, the patient is very irritable, he has become very angry, he has become this, that, snappish and all. But that is a quite normal symptom. If you have migraine so much, the patient had brought the painkillers in his pocket also, and he was showing me, see, I always carry a painkiller, I always carry Vicks, I always carry balm. So if there is so much pain, the patient is expected to be snappish, to be irritable, to be whatever angry symptoms you have. If you prescribe on that symptom, angriness, you will always give remedies, whether remedies are malicious, vindictive, like anacardium, like hipersulf, like sulfur, like lacasis, but it will never cure. So the defining symptom is of the chief complaint is so important, and I have today only cured that case of migraine. I hope you understand this. Then I'll go to other questions. Okay. Yeah. So in Instagram also people are liking it. I hope some medicine for relief eczema itching on the buttocks area. I'll get to you, but let me basically first complete this. Now, for example, a patient comes to you. As I always tell you, complaints for constipation. Now, whenever a case comes for constipation, we always jump. And whenever constipation word comes in our mind, there are 3-4 remedies which are so commonly prescribed by the doctors. One is alumina, second is Naxomica, then Thuja, then Lagdef, and Timcrude opium. But I always ask you to define how is the constipation. Whether you get urge to go to stool or you don't get urge only to go to stool. If you have urge, that means the rectum basically is not working properly. There's inactive rectum. And if there is no desire, that means totally atone is there. So then you differentiate the remedies, then prescribe. Or the patient says, when I pass the stool, it is very painful. The stool is very large and hard. Then the remedy changes. Or the patient says, I had constipation since years. So don't treat that. That is not important. But treat now, I'm suffering from blood pressure, I'm suffering from diabetes. And if you look at the repertory, constipation is very chronic. There are 3-4 remedies which are so important: Calcarea, Naxomica, opium, sulfur. Or the patient comes and tells you, I have constipation since my climateric period. And the remedy, it is neither opium, neither Naxomica, neither Calcarea, neither alumina. It is only Graphitis and Veratrum. Are you getting me? Are you getting the importance of chief complaint? Always don't jump to the mind because somebody has told you mind. The importance of chief complaint is also very important to understand and then prescribe. I hope you understand that. I today had a case. I'll just tell you a case. Yesterday night, I had a call at about 1 p.m. in the night, 1 a.m. I should say. The person, my friend's daughter, had severe pain in the abdomen, lot of cramps, so much so cramps that she could not decide whether to go for stools and sit there or come here. And there was a lot of purging. Immediately when cramps come, so she said, I've already given her Macphos, I've given her arsenic because stools was very offensive. And the patient had so much pain that she told me, sir, I am tired of that pain. Now I don't have that energy to bear that pain. There is so much cramps in my stomach. I cannot bear that cramps. So what remedy comes to your mind? What remedy comes to anybody? What remedy comes to your mind? And I gave that remedy, and the patient is much better in the morning. What is that remedy? Anybody? I'll get to you, Dr. Alam. Just let me finish the one part of case taking, which basically people wanted me to tell something. I'll come to that question. But can you answer this question? The patient 1 o'clock in the night calls you that so much pain, there's so much cramps that she cannot pass to, she does not know whether to go and sit at the potty or go at the stool or sit at the sofa whether to lie down, what to do. There's so much pain, there's so much weakness, she's exhausted because of the pain. The stools are okay, but stools are very offensive. She was already given Macphos, she was already given arsenic album. Nothing was, in fact, arsenic album was given every 10 minutes, 10 to 12 dose, nothing worked. Macphos was given, but there was no relief in the cramp. What remedies come to your mind? That is so important, And I just asked that patient, okay, how do you, when do you feel better when there is cramps? And the answer was, I don't feel better in any position. I don't feel better in any position, whether I lie down, whether I sit, bending double also, only for partial second, then it back to square one. And I'm telling my mother, look what I'm telling my mother, don't give me anything to drink, because my mother is giving me ORS, my mother is giving me lemon water, my mother is giving me some kada, and I'm telling you, don't give me, because I have a lot of pain. This was the only symptom told by the patient. And I immediately gave that remedy, 1 single dose. Today morning, she says that she's 50% better, stools are better, the cramps are better. Now she has eaten something, but she is much better with that 1 dose of medicine, just because I was able to define that chief complaint of the patient in the rubric form. So we have remedies: colocynth, moxol, coffea, colocynth. See, there are a lot of difference between colocynth and moxol. Any other remedy? Can you guess? Anybody? Just now in the morning, I've cured that case. Anybody? Which symptom I took for prescription? Chamomilla, Mercor. Okay. Anything else? First of all, understand the case. Now, why Naxomika? Okay. Imagine the wordings. I tell my mother, don't give me ORS, don't give me that coconut water, don't give me some kadas, because I cannot drink it. I get a lot of pain because of that. And I immediately told the patient to take 1 dose of plumbum metallicum. Plumbum metallicum aggravated by taking liquid. And that remedy worked wonders in that case. And the patient was better in the morning. So this is how the patient will tell you symptom. Sometimes a very common symptom, a common saying of the patient, we will say, okay, she's complaining because she has cramp. But no, if your materia medica is good, that liquids aggravation, liquid causes lot of cramps. The patient says, I have no relief of cramp from sitting, lying, or going to the potty, but I tell my mother, don't give me liquid, the pain increases. Plumbum metallicum, 1 single dose, and the patient is better 50%. In the evening, I don't know, in the evening she'll come, and again, I'll tell you on the next YouTube live how the patient reacted. So I hope you understood the meaning of defining the chief complaint. I always tell to my colleagues who are working with me now, there are the OPD has swelled, so my assistants have also swelled up. There are a lot of assistants coming and joining me. I try to be very simple. Take the case, what the patient is telling you. Remember aphorism number 6. Try to define the chief complaint. Sometimes we are not able to define the chief complaint. It's okay, then forget it. Go to some. Don't make or create your own symptoms. Don't create your own symptoms and then create a remedy and then say it is not working. I hope you understand the importance of chief complaint. Yeah. Yes, you can apply, because whatever symptoms that comes to us, it is important. And see, surprisingly, plumbum metallicum, we have been taught, there is so much pain in the abdomen that abdomen is feels as if it is held by a string, and a lot of constipation. But this patient had such a cramp, and the importance of now string sensation. The patient's abdomen has become convex. It has gone inside because of the cramps, and then every symptom of plumbum met will match. But it is important here to identify plumbum met. Yes, Dr. Babel drinks. I did not know the exact symptom of plumbum met, but I knew that I had read plumbum met somewhere in Materia Medica, so immediately I told plumbum met metallicum 1M. So did you understand the importance of the defining the? There are a lot of examples I can tell you, but I think we are more into that question answer sessions and all. That's why I'm just telling you the importance of simple homeopathy and simple prescriptions. Simple prescriptions. If you hear from the assistant doctors or the colleagues working with me, they are very surprised. Sir, such a simple prescriptions, no theories, no themes, nothing is there. Such simple homeopathy is very simple. The importance is what symptom you are taking for prescription and the art of interpreting the patient's language into the repertory or the mathematical form. I hope you understand, and then we'll start the question answer sessions. Sorry, Dr. Alam, the questions you have told has scrolled up. So if you could write the question again on Instagram also, we have some questions. Yeah, I never knew Instagram and YouTube live would be so many audience have to handle. So did you understand those? So and now I am taking offline classes also, and it has been really interesting seeing the audience in front of me, students, and then interacting with them. So this was a beautiful case of a chief complaint, and in future I'll tell you something more about case taking. But today I hope you understood some part of case taking where you could identify the chief complaint and the defining feature of the case. Good afternoon, Dr. Singh. So, and one more thing that I had, if you are in a WhatsApp group, there was a doctor from, I think, Patna, Bihar. Dr. I think Singh was there. He had used my COVID-19 case and he has got a tremendous result. Tremendous result. I think he was treating a case. I don't know exactly the case. I think he was treating a case of arthritis, and the arthritis came to a halt. I'm just telling the experience. It came to a halt. Then he came to know that the patient had suffered from COVID-19. So he gave my COVID-19, which I sent him, that single dose as an intercurrent remedy. And he told me, when I gave COVID-19 your dose, after a few days, the cure started and the patient is much better with that COVID-19. So he has got results with that COVID-19 as an intercurrent remedy, as an intercurrent remedy. So thank you for sharing your experience, Dr. Singh. And he has used that COVID-19 as an intercurrent remedy. Persons who are suffering, who had COVID-19 infection or vaccines, and in a chronic case, if you feel stuck up, you can use that COVID-19, what I have sent you as an intercurrent remedy, to clear up the case. Okay, so I hope that also is a very, very encouraging result of that medicine which I have made, and I know that it is working now. So welcome, Dr. Baba. So we have some questions here. Post-hepatic pain starts from inner angle of the right eye, brows, and goes back. Oh, post-hepatic pain starts from inner angle of the right eye and right eyebrow and goes to the back. Now, see, if you are treating a case of post-hepatic pain, or whenever the nerve pain is involved, you have to think about remedies in related to nerves. Now, if you see, or if you have checked your Mater Medica, and if you try to analyze this herpetic, post. So if you try to analyze this, you cannot see what happens, that herpes virus has eaten away the nerve. So there are indentation in the nerves, and that is very painful, And whatever cases I have treated or cured of post-herpetic, I have had very good results. Of course, there are some remedies which are very, very common, which are very, very specific sometimes. Like we have ranunculus bulbosus, we have rustox, we have hypericum. Now, in these cases, where this fails, I have got results with 3 remedies, and I have used that so many times in my practice, and I have got very good results. It is basically, I use that syphilitic nerve lesions, anacardium, kali iode, and phosphorus. These are the 3 remedies which have given me good results when rustox, hypericum, and ranunculus bulbosus have failed. First. Second, it is very important that at what time of treatment the patient has come to you. If the patient has come to you immediately when he gets that infection and comes to you, then with whatever homeopathy remedy, the similimum you have prescribed, it will work. And you can use that. So herpes infection, no, you are telling, involvement of the nerve is there. So apart from this, anacardium, phosphorus, and kali iode. Patient having early menopause leading to joint pains, deep breath after every 50 minutes leads to severe pain in the left knee. Okay, so early menopause. Now, first of all, see what happens if the patient has come to you with early menopause. If the physiology is disturbed, okay, when the physiology is disturbed, then you have to think some remedies which are indicated in those complaints. For example, in climacteric period, in climacteric period, you have to first, I always first go with generalized and then go for particular. Now, if the patient has come to you with early menopause, that means the physiology has been disturbed. So you have to prescribe remedies which are generally indicated for climacteric troubles. Of course, there are so many remedies, there are so many, but whatever remedies which I have got good results, you have to think about. First is, I always say, semestifuga. Second, lachesis. Third, a very important remedy, that is pulsatilla. And one remedy that you must have never heard about, and it is a very very important remedy of climatic period, that is sorinum and calibrom. In your case, Dr. Navjot, you must give two importance to two remedies. The first is calibrom, and the second is sorinum. So one question is on the, I think, Instagram. So I'll just finish that question. The patient says that whenever I have lost my child since about 5-6 years, and now since that feeling of whatever grief has not gone, and still I am not able to come terms with my life. Not happy, just living because she's living. Her wordings were, I am not living, I'm existing. In that case, I prescribe the remedy calibrom. Instagram, I'm telling you, calibrom 1 ml single dose, and the patient came out, and he was, of course, calibrom will not wipe out the memory of the death of a child, but it will acclimatize the patient to live in today's world, in today's era. That is what calibrom did to that patient. Post-hepatic pain, there are two remedies which are very important, Dr. Sasdev. I just got it wrong, I think, because for the first time I am doing Insta live and YouTube live same. So post-hepatic pain, important remedies, podophyllum, cardusmar, and one remedy that you should always remember in post, it is taraxicum. Taraxicum is also very important. Upper motor neuron disease, paralysis, lower limb, left to right side, care of ciliary neuralgia, umbilical hernia. Yeah, Dr. Shraddha, it's upper motor neuron disease. No, in this case, if the patient got paralysis, it is very very important in this case to take the whole history of the case, because if you don't know why the patient is suffering from motor neuron disease, how will we be able to prescribe? So I don't have any specific for this disease, but whatever results I have got, I have used remedies like causticum, I have used remedies like physostigma, I have used remedies like plumbum metallicum, phosphorus, agaricus muscarius. These are the remedies which I have used. I have got fairly good results. Sir, patient having problem in traveling by car, especially in hilly region, which makes him give nausea, dizziness, sometimes vomiting for several days, other than petroleum kindly has. Patient having problem in traveling by car, especially in hilly region, which makes him give nausea. Now see, this symptom, traveling sickness, or what you call motion sickness, is such a common problem, and if the patient comes to me also, sometimes it works, sometimes it does not work, Dr. Sangma. Let me be very, very frank. So if you see remedies apart from petroleum, if you want to see, you have to think about remedies. See, there are, of course, one remedy that you should always remember, Dr. Sangma, is Cocculus indicus first. Second is conium, and the third which I have used in my practice is Arnica montana. These three remedies, of course, then differentiate with your symptoms, and you can prescribe the remedy. Doctor, I mean post-hepatic pain. Yeah, that's what I'm telling you. Yeah, so I think I have enough. I think I've talked about case taking, but people want me to talk again about case taking. I'll just come to that. What is your understanding of studying remedies? Sparrow. Okay. First of all, one thing is very sure in studying Mater Medica is important is reading a particular book. See, everybody has an inclination or likes a certain book. Somebody may like Alan's Keynote, somebody may like Clark, somebody may like Boric, somebody may like Kent. Depending upon your miasm, depending upon your liking to a particular author. So, whatever books you like, it is important to read that book every day. Listen me out. I'm telling you to read that book every day. Don't try to mug up symptoms. Don't try to mug up the symptoms. Don't try to basically understand and keep writing and making notes. Just keep reading. Just as you hear certain music, certain songs every day, and you automatically start to know that song very easily. In the same way, keep reading books. Keep reading that book which you like. Automatically, that Mater Medica will, that symptom will come in front of you. Then, when you have already read it, make sure that whatever cure you have done to that patient, write down that remedy, what symptom you have taken for prescriptions, and write down some features of the patient that you have found very close to the remedy. For example, if a remedy X has cured a patient, look at the hairs of the patient, look at the ears, look at the skin, look at the nose, look at the nails, and then make your own notes. So next time, when you look at that nose, hairs, or eyes, and you feel, oh, this is the remedy which basically I had used and cured that complaint, so automatically it becomes a clinical proving, it becomes a clinical match in your OPD, and automatically you start developing that way of understanding Mater Medica and clinically verifying that symptom. That is very, very important. For example, if ignitia is given to a patient, it is written in a book, ignitia, it is written in a book. For example, I tell you why I'm telling you, I'll just tell you the answer also. Now, anybody can tell me what is the very, very important symptom of opium? Anybody? Anybody? What is a very, very important symptom, 3 marking symptom of opium, which is written in a Mater Medica? Anybody? Everybody has read that remedy opium. What is the most important symptom of opium? Imprinted fear. No, opium. What is the classical symptom? Fear, lot of remedy has. But what is the classical symptom of opium, which is written as a black letter? Anybody? Sleeplessness? No. Important symptom. And I'll tell you how you have to learn the remedy properly. No. See, just try to make homeopathy very simple. This constipation, breathing, sleeplessness, painlessness of complaints which are usually painful. See, it is fantastic symptom that painless, the patient does not feel that. Yes, everybody is right. So, let me ask you, if painlessness of complaints which have to be painful, how would be the senses of opium patient? Anybody? Just try to explore your own knowledge of Mater Medica. How would be the sensitiveness or the senses or the sensorium of an opium patient? Anybody? Painlessness of complaints which are lower. Yes. So, how many of you low sensitivity? Very nice. So, how we are asking sensitivity or sensorium? Indifference, diminished. Yeah. So, how many of you agree that the sensitivity of the opium patient is low? Anybody? You can either write yes, no, or a good thumbs up. Yes, everybody is right. Benumbed, indifferent, low sensitivity, lower. Instagram also, people are very fast and they say it is low sensitivity. Yes, right. Everybody accepts. Now, if you have read Mater Medica, also high. Dr. Tunis is also high. And homeopathy, anything is possible. If you open Ellen's keynote, if anybody has it, open Coffea cruda. If you open Coffea cruda, the second line of Allen's keynote, Coffea cruda, oversensitiveness of all the senses, more acute sight, hearing, smell, taste, and touch. That is Coffea cruda. In bracket, there are 3 remedies. One is belladonna, one is chamomilla, and one is opium. One is opium. Now see your knowledge of Mater Medica. Somebody has taught you that opium, just think about the painlessness of complaints And here Dr. Allen's right, in coffea cruda, oversensitive to all the senses like smell, taste, hearing, belladonna, chamomilla, opium. Now if you basically are very much what you call happy and very much influenced by some of the good stalwarts, and you have been imprinted in your mind that opium, just look at the painlessness. Now painlessness of complaints, usually painful, are also is also a syphilitic symptom, out of control, and oversensitiveness is also syphilitic symptom, out of control, but both are opium. This is what I tell you, read every day and you confirm your clinical proving from your patient. That is very important. You have to get influenced by yourself. Remember my wordings, get influenced by yourself. That is very, very important. Understand? Get influenced by yourself. Instagram also people are doing thumbs up. This is how you have to learn Mater Medica from yourself. If you see coffea cruda, nectar monsoric face can be very happy and dancing. Yes, yes. I'm just telling you the Mater Medica. How, just somebody was asking me, that how do you study Mater Medica? This is how basically we study a Mater Medica. And I was waiting for Dr. Amit to basically start a Mater Medica classes. He was doing it because I need somebody, to do some Mater Medica classes. Then I can join in, because otherwise I am basically doing Insta live and YouTube live every second day, third day. So I'm not getting time to have those. But Mater Medica basically is a very interesting thing, and I am teaching Mater Medica also in one of the college, and very surprising, and I'm very happy that I was going to teach there only the third year students, and now whenever I'm going, the whole of the first to the final year and the staff are sitting when I'm teaching Mater Medica. So basically it is a responsibility on me also, and it is on the second time I have to read Mater Medica also, and thirdly it is such an interesting and a beautiful thing to teach students. If you can enlighten the students with simple Mater Medica, it will give you such beautiful results in your practice that you will start liking the subject very much. I hope you understand. Mater Medica is such a subject. Now coming back to case. Okay, today I have to discuss something about case taking. Yes, Dr. Amit. That's why the last time also I told you that do make a beautiful group, and then we can start, because my assistants and my colleagues are so busy in my arranging my Instagram and YouTube, and now that these webinars, and also they don't get time basically to get together. And I'm doing every second Sunday that international case taking, and also I'm busy there also. But I would like somebody to take initiative. Dr. Amit would have taken the initiative. Sir, kindly share experience on gallstones. No, deal with it. Yeah. First of all, Dr. Sangma, the important thing is that gallstone, if you ask me also as a clinician, it is really difficult. Not all cases I am able to treat gallstone, but definitely that I have got good results with gallstone. As I have told in my previous YouTube lives and previous, I think, in my Facebook lives, there are some remedies in gallstone which are very, very important. For example, if you have read remedies like Filtauri, you have seen remedy like Cardusmar, you have remedies like Colocynth, you have remedies like Berberis vulgaris, you have remedies like what do you call Chilidonium. These are remedies which have given me very, very good results. Of course, as I always tell you in case taking, suppose in a gallstone case, if the patient is classical coming and telling you that whenever he gets a pain, there is a lot of cramp, especially on the right side of the abdomen, then go to that remedy and then get the right side of the abdomen case. If the patient gallstone said, whenever there is gallstone pain, I have to just sit, I cannot move, then the remedy changes. So if a gallstone has a defining feature, then go with that feature. Otherwise, these remedies are very, very useful. Okay. For example, when I had a case of gallstone, I had a case of gallstone, and the patient had a typical tongue, the patient showed me the tongue. There was a white film on the tongue, and the patient told me the red spots which you see on my tongue is basically when I remove that film, so that area becomes sore. So the red spots are those spots where I have taken out that film on the tongue, and those spots have become very sensitive, and when I eat, it causes burning. A case of gallstones. Which remedy would have I prescribed? Anybody? Yes, on Instagram we have 3 remedies. Anybody, which remedy comes to your mind in these cases? Don't prescribe on WhatsApp, because WhatsApp, Instagram, YouTube will be very difficult for me to. Yeah. So, which remedy comes to your mind in that case? A patient of gallstone, sarsaparilla. Okay. Anything else? Taraxicum. Yes. So, this is a very, very interesting symptom of taraxicum. See, just simple case taking, the defining feature of that gallstone patient and the remedy, it is taraxicum. If you open simple remedy, don't see, go to Clark Matermedic or Kentman, just open Allen's keynote. It has written, no, it is taraxicum. The film comes out leaving dark tender spots, which are very, very sensitive. Because map tongue, you can have taraxicum, natramure, I think lachesis also. But when the film comes out and there is sensitive and raw spots, the remedy is taraxicum. So what case taking we did? We just did the case taking, the defining symptom of that gallstone colic, gallstone patient, a very 3 marking symptom, and we got the remedy without any airs and without any themes and without any what you call, you understand what, map tongue. Yeah, you can have, no, whatever knowledge I have about map tongue, there are a lot of remedies for map tongue, but whatever remedies I have found useful for map tongue is taraxicum, lachesis, I think one is mercury, natramure. These are the remedies which I have used very frequently in my practice and I have got very good results. Of course, if you open the repertory for any symptom, for any classical, you have so many remedies. I'm just telling you my experience and in my clinical approach in a case of gallstone. So I hope, Dr. Sangma, you got some remedies for gallstones also and something in relation to the defining feature in the case taking. That is so important. For example, today I had a case where the patient came and told me that he is a case of cirrhosis of liver, and he came and told me that the urine is very dark and very sometimes black in color. So he's much better with the treatment. If the cirrhosis of liver is much better, the liver size has increased, the patient is able to eat food, the ascites has gone down. With this symptom, black urine, he had one symptom very, very important. His tongue was absolutely reddish. It was absolutely reddish, as if it was like glaze. It was shining. So as the patient, have you had some strawberries or you had some, you get that ice gola and you put that red rose water and eat ice gola. It was like an ice gola, absolutely flat and glazed. And the patient that came and told me that I have black type urine. If you open the Mater Medica black urine, you have I am telling you 3 marking remedies: colocynth, terebinth, lachesis. Most of us would think about lachesis because it's a polycrest remedy, but if you open the Mater Medica of terebinth, it is written the tongue is glazed, it is deprived of papilla, it is glazed. And then I give the patient terebinthina. Now, terebinthina, cirrhosis of liver, no relationship, but that remedy worked. That is the importance of. Are you getting the case taking part? I have taken out 4 or 5 cases for understanding the case taking of the chief complaints. So the defining feature is, if it is present, it becomes a very, very important symptom of that case. Did you get me? First of all, did you get terebinthina? Did you get how do you prescribe? See, homeopathy is a very, very vast, mathematics is a very, very vast subject. For every symptom, you get one remedy. Importance is what to take and what defines the disease and what defines the patient. That is very important. So, in case taking with that chief complaint, your observation is very important. What to observe in that patient? Your observation becomes a very, very important defining feature for yourself. And your observation depends on which miasm you are living in. Are you in psoric phase? Are you in psychotic phase? Or are you in syphilitic phase? A syphilitic miasm, in you will only see that syphilitic symptom in that case. A psoric miasm would see a lot of symptoms. So depending upon your miasmatic schedule also, the remedy would change. Are you getting me? Miasmatic casting, yes, that is. So Dr. Singh says, what if patient's tongue is coated yellow, teeth mark at the sides and smelly? Yeah, you can have. See, there are a lot of remedy. If you just open the chapter of tongue, and you see there are so many. I was just trying to explain you all what is the importance, of that defining feature of the case. That is important for us. Map tongue, you like for example, Doctor Singh says map tongue, that and the sides are imprints of teeth. You can have map tongue if you. I think if you open Alan's keynote Natramure page, in Natramure it is written map tongue with insulin on sides. Then you have comparison like Natramure, arsenic, lacasis, mercury, nitric acid, taraxicum, lot of remedies. But I am not here to basically give you one symptom and 10 remedies. I am here only to give you what I have used and what I have got results, and I have shown you results black and white on the patient. That's why I'm here to. Otherwise, you can open the repertoire and you can get lot of remedies for that. So this is how. Sir, sticky discharge from the eyes. Sticky discharge from the eyes, Doctor Sachdeva. Again, I am telling you. Now, sticky discharge from the eyes. Instagram also has few questions. I forgot that I'm on Instagram. Sorry. So sticky discharge from the eyes. If you open eyes, and if you see discharge, see there may be so many remedies, Dr. Sachdev. There are so many remedies, but first of all, understand whether you want to treat that sticky discharge, or just tell the patient to just wash the eyes with cold water for some time and he should feel better, or he should feel better. Then you have discharge, how much sticky, like gummy, like the discharge sticky is or stringy or very thick. Like for instance, we have viscous discharge, watery discharge, stringent discharge, and thick discharge. If the discharge from the eye is a very very sticky mucus, euphrasia is there. If it is very thick but not sticky, then Nactromure is there, Scalipico, euphrasia is also there. It is very thin, like watery, graphitis is there. If it is very viscid, then Nactromure and hydrastis is there. So there are so many things, but I would basically not treat those discharges. I would just tell the patient to just water the eyes with cold water and wait for some time. If it does not go, then try to prescribe the remedies. Okay. Difficulty in passing urine, especially in children where urine examination is normal. Please say some. Difficulty in passing urine in children. What happens in children? Sometimes in children, I have seen most of the cases where the phimosis operation has not been done. That circumcision operation not been done, and the children have a habit of not basically doing that exercise of taking that extra skin behind, so it causes an infection. And when there's an infection, when the patient goes to pass urine, he only passes few drops, and then if there's because of the pain, it does not pass urine, and that causes retention. That is important. So in case of circumcision not done, in case of infection, or in children, in case where the children are so playful that they forget to pass urine, and when they pass urine, they are so painful, it is so painful, that they have to immediately go and they pass the urine in the pants also. There are remedies like lycopodium, there are remedies like calendula, there are remedies like equisitum, remedies like causticum, remedies like alumina, carcinosis, staphylococcus, which has got fantastic results. If you have seen, there is a rubric in repertory, that the patient has a habit of suppressing the natural discharges, and it is such a very very interesting, suppression of natural discharges. For example, if you tell if the mother, if the family goes out and the mother tells the child, go and pass the urine, we have to go for a long journey, and the child says, no, I'll go tomorrow in the morning only. The child has an inclination to suppress the natural desire, and this is a very very common symptom of cilicia, staphylococcus, and carcinosin. So this is how you have to interpret and then define that basic symptom. Sir, please explain about Tourette syndrome, miasmatic casting, always been interesting. We can be in a WhatsApp group. Yeah, WhatsApp group is there. WhatsApp group is there, but teaching basically, mathematica is such an interesting thing that I have learned when I'm teaching now offline, and when you start acting the remedies, it is such intense, and the audience, the energy of the audience basically is so what do you call, creates that enthusiasm in me, that you enjoy talking to that, and then you actual interesting mathematical symptoms. And interesting thing is that how to remember those symptoms, and how to get that theme of the how to remember the symptom, and how you can apply that symptom in clinical practice, that is important. So let us go to have some other questions. I hope Dr. Amit must have understood. Sir, please explain Tourette syndrome. Tourette syndrome, I think last time also somebody asked me. Now, if you have seen a case of Tourette syndrome, if you have seen a case of Tourette syndrome, there are two major motor tics and at a least vocal noise. So I would basically go for symptoms rather than treating the disease. See, it's a neurodevelopmental disorder that begins in the childhood. That begins in the childhood, and then you can have those symptoms like multiple movements, like motor movements, like tics you have, and then you have phonic movements, then you have tics movement like blinking, like coughing, clearing the throat, sniffing, facial movements, lot of things you have. So at that time, if you find the symptom very defining, for example, if the patient has a habit of clearing a syndrome, clearing the throat every time clearing with loud noise, go to that, because that symptom has been glorified and highlighted by the patient constitution, and then he gets the symptom. So neurodevelopmental in that case also asks the history of the parent, especially mother, during pregnancy, and then you can fit the chain of events happen in the patient's life, and then you can prescribe. Okay. Miasmatic case taking, yes. See, whenever you are taking a case, no, don't have that habit, okay, which I have got a very syphilitic case, so I've got a very syphilitic remedy. Every remedy is all try miasmatic remedy. And in case taking, if the patient is definitely suffering from maybe renal failure, so don't ask the patient whether you like to be weeping ameliorates, consultation, those are all soric symptoms. So this is basically a part of case taking. A syphilitic, there's nothing as soric case taking, psychotic case taking, syphilitic case taking. If the patient is suffering from syphilitic case taking, it is very important to understand that which symptom is most syphilitic in that case for you to prescribe. That is important for us. Okay. We can be in a WhatsApp group asking this, sir, how to approach in head tetanus. So for example, tinnitus. Again, I would like to say tinnitus for me also sometimes is such a, what do you call, annoying symptom. It is not an easy symptom to treat tinnitus. But see, as again say, tinnitus, if it is if it is annoying, make sure that you ask the patient which is the most important thing. How did it start? Any event before tinnitus is important to prescribe. Are you getting me? You heard this out, because tinnitus is such an annoying complaint. You have to ask, how did it start? This is a very important symptom, because if you don't understand that how did it start, and if you keep prescribing, that the patient says that tinnitus is more in the morning, and gets up in the morning he has, after eating he has, you start giving the remedy for different modalities, he feels better after eating, then something else starts, he feels, you give that modality, it cures, and something else starts. So everything will start, and you'll be in as Dr. Kent has always said, a patient of asthma comes to me for sneezing, running nose. These I give medicines for 6 months, and after 6 months I realize, why did I give a medicine? It was just an indisposition, nothing had to be given, and I have wasted that remedy. In the same way in tinnitus, if you keep asking on a symptom, the patient will keep changing symptom every time he comes to you. It is important in case of tinnitus, ask how did it start. If you can get a very interesting cause, how did it start, automatically it will be taken care of. Urine infection. See, if the pus cells is 15 to 20, just ask the patient of the local symptom, Dr. Sachdeva. How is the urination? Painful, painless, with fever, how much is the fever, how is the fever, and there are very common remedies which will definitely work, like canthus is there, sarsaparil is there, terebinth is there. These are remedies which will work in your case. Child, when anger comes, he sleeps on Abuse of mercury means basically what happens. There are a lot of there are a lot of things in your daily routine. You eat a plant, you eat something which has a mercury content in it, and because of that, eating that part or eating that or applying that cosmetic or applying using that product which contains the mercury part on it, that causes symptom, then it is abuse of mercury. Child, when anger comes, he sleeps on floor and cries. Elaborate. Yeah, it is important. Anger tantrums you can take and then you can prescribe. Which remedy comes to your mind to clear the throat? Hawking constantly, especially before and during talking. Yeah. So this is, such a interesting symptom also, because when I was taking basically I was teaching maternal medical in a college, and see, I there was a chalk, so I was continuously hawking, and immediately one of the teachers told me, sir, you have a problem of hawking because of chalk, you have a problem. And I said, okay, it's not like that. So any allergen which basically that body does not want inside, the body tries to take it out. Whenever while talking, remember this, whenever while talking there is a problem of hawking, remember argentum and calcarea phos. Very, very important remedy. Very, very important remedy. And there are remedies where the patient keeps hawking every time. In sometimes psychology, it is called as conspicuous behavior. You are sitting here, somebody passes in front of us, he goes. That's a conspicuous behavior. Two remedies I have used in this case in relation to mind with hawking constantly: Elianthus and Kajuputtam. Very, very interesting. Constantly hawking. Okay. So it has some psychological background also, if it is not because of indisposition. Tinnitus after sudden loud noise. Yeah. So Dr. Babel, you can take that as normal, because when you go when we in India also, when we go to a marriage and you just pass the gate and loud music going on, and it is so loud in the ear that when you go to the hall and you sit down, that music still plays for some time and automatically it gets down. The problem starts when it does not get down, and then you have to take the rubric, the patient is very sensitive to noise, and then go to the remedy. Okay. Suppose if the patient don't know how it start. No. See, the patient might not know how did it start, but then you can always go behind and ask from how many time. He'll say 6 months. What happened before 6 months? Where did you go in 6 months? Then he immediately, I had gone to a party, and then somebody told me this and that, and I heard something, and then it started. You will get a history. That is very important. Case taking. Okay. Now, historic use of mercury for syphilis. Yeah, thanks. सोरेसिस का मेडिसिन बताइए सर. कुमार, मनोज कुमार जी. सोरियस के बारे में मैंने मेरे ख्याल से बहुत बार बताया हूँ कि यूट्यूब में, मेरे इंस्टाग्राम पे, मेरे फेसबुक लाइव पे भी. सोरियासिस एक मेंटल डिजीज़ है, ऑटो इम्यून डिजीज़ है, और सबसे बड़ी बात है कि सोरियासिस बिल्कुल क्योरेबल है. सोरियासिस के अंदर ये आपको देखना है कि स्ट्रेस लेवल, उसका एंग्जाइटी लेवल, उसका सप्रेशन लेवल कितना हाई है. उसी प्रकार से आपको सोरियासिस को ट्रीट करना है. कभी कभी क्या होता है कि हमारी सोच, हमारी इच्छा है, हम चाहते कुछ है, होता कुछ है, हम अपनी इच्छा को दबा कर रखते हैं और बॉडी वो इच्छा को निकालना चाहती है, वो स्किन के रूप में निकालती है, बार बार स्किन का मल्टीप्लिकेशन बढ़ा देती है, तब भी सोरियासिस होता है. सो इसके लिए मैंने आपको 2-3 रूब्रिक बताए थे, जैसे कि विल कॉन्ट्रडिक्शन ऑफ एक रूब्रिक है, जिससे हम चाहते कुछ, हम करना चाहते एमबीबीएस, लेकिन कर रहे होम्योपैथी. भले बहुत फेमस होगा होम्योपैथी, बट हमारी इच्छा थी कि हम एमबीबीएस करें. फॉर एग्जाम्पल, बहुत डॉक्टर हमको पता है कि करते हैं एमबीबीएस, लेकिन सपोज एमडी क्लियर नहीं कर पाए तो होम्योपैथी कर लेते हैं. ठीक है. उसके बाद होम्योपैथी फेमस हो गए, बट उनको बनना था डॉक्टर एलोपैथी का ही, तो उसकी इच्छा को मारा. भले दिखते बहुत अच्छे, बट अंदर से स्किन मल्टीप्लाई होना शुरू हो जाती है और पेशेंट को सोरियासिस या कोई भी ऑटोइम्यून डिजीज हो सकता है. तो ये सप्रेशन जो विल चले गया, वो बहुत इंपॉर्टेंट है जानना हमको. Very interesting. He is very annoying, always hawking. The family makes fun and says the patient does it purpose. Yeah, so fantastic, Dr. Alexander. This is what we called as a conspicuous behavior. Okay, very nice. Instagram also, there are about 4 or 5 questions. It is actually difficult to stream on both the lines. Sometimes it's already 1 hour, but still we are left with so many questions. I'll take this question from Mr. Jack Sparrow. Pulsating sound in the right ear in silence room. Better by fan sound or listening. Nux 01 for the complaints. When I check ear noise, Nux is second grade. Remedy, is it aggravation? So yeah, it is not aggravation. Basically, you can see it is not aggravation. What see, जब room बहुत silence है, जब पूरा silence है, जब everything is silent and still the patient has that fan sound or the complaints, so you can take that remedy and not aggravation, or you can take the remedy because of that. Maintaining cause also is very important in this case. Nitric acid is one so good. You think about graphites, you think about phosphorus, you think about sulfur also in this case, and that would give good results. So my dear friends, I think it's already 1 hour, and I enjoyed today talking to you on YouTube Live and talking to all my followers on Instagram Live also. So thank you so much. Thank you for joining. Rest of the question I'll try in my next YouTube Live or whenever we take a Google Meet, off the line or online. Thank you so much.